According to the Centers for Disease Control, over 100 Americans die every single day from opioid overdoses. For the families in this march, that statistic represents a personal loss. The roots of this epidemic are found in modern medical treatment. The crisis often begins with a legitimate medical prescription intended to help the body recover from severe pain. These drugs are prescribed for moderately severe or severe pain. They include oxycodone, hydrocodone, morphine, and methadone. Heroin, though illegal, is part of this same chemical family. To understand why these substances are so dangerous, we have to look at how they mirror our body's natural biological signaling. Normally, harm is converted to a nerve signal traveling through the spinal cord to the brain, perceived as pain. Opioid molecules attach to cellular opioid receptors, physically blocking these pain signals. Simultaneously, they trigger the brain's reward pathway, releasing dopamine to generate an intense high. Beyond the brain, the drugs affect other systems, slowing your breathing and reducing the motion of your intestines, which often results in constipation. When taken as prescribed for a short duration, opioids are effective medical tools. However, because they use the same receptors our bodies use for vital survival functions, they can trigger a dangerous biological cascade if they are misused. Misuse often starts the first stage of this cascade, tolerance. This is the brain's physical attempt to maintain balance despite the presence of the drug. Over time, your opioid receptors become less sensitive. This chart illustrates how the body requires a larger amount of the drug to achieve the same level of pain relief that a smaller dose once provided. This leads to level 2, dependence. At this stage, the body has adjusted its internal chemistry so heavily that it relies on the drug just to maintain a normal state of function. If the drug is removed, the system crashes into withdrawal. This results in severe flu-like symptoms, including muscle aches, nausea, stomach cramps, and extreme anxiety. While dependence is a significant physical restructuring of the body, it is distinct from the psychological pathology of addiction. You can be physically dependent on a medication without being addicted to it. Level 3, addiction, is a separate condition. Addiction occurs when the drug rewires the brain's hierarchy of needs, prioritizing the substance over basic survival requirements like food or safety. This shift in the reward circuitry turns a craving into a biological imperative, which is why it is classified as a brain disease. The hallmark of this disease is the inability to stop taking the drug, even when it is causing clear and devastating harm to your health and your life. In this stage, the medication is no longer a tool for pain relief, but the primary driver of a self-destructive compulsion. The final and most dangerous stage of this biological progression is level 4, overdose. An overdose happens when the volume of the drug overwhelms the receptors that control your breathing. As shown in this comparison, the rhythmic signal for respiration slows down significantly and can eventually stop. This system failure produces visible symptoms like extreme sleepiness and unconsciousness, dangerously constricted pupils, and slow or stopped breathing. This specific biological failure results in the national statistics reported by the CDC, more than 100 Americans dying every day from opioid overdoses. If you or someone close to you needs help for an opioid use disorder, please talk to a healthcare provider. Opioids are highly effective medical tools for managing severe pain, but because they interact so closely with our body's vital survival systems, misuse can lead to a total collapse.